My name is Rich Gumina. I grew up out in Daly City, California, just south of San Francisco, and did undergraduate work at University of California, Davis. I went to medical school at the Medical College of Wisconsin in an MD PhD program, and after the Medical College of Wisconsin, I did my medicine, cardiology, and interventional cardiology training at Mayo Clinic. After I went on staff at Mayo Clinic, I had the opportunity to develop a research program at Ohio State University, where I was for 7 years, and then subsequently went to Vanderbilt University for the past 5 years in a role as a practicing interventional cardiologist and running a research lab. So I've always been interested in medicine, in trying to figure out ways that we could help people who are suffering from various diseases. And my interests have always kind of drawn me to cardiovascular. And because of that, I've tried to marry both a clinical practice and my research endeavors. And I think one feeds off the other. I'm able to, as a practicing interventional cardiologist, recognize where some of the gaps are in our knowledge, or where some of the things are that we need to improve to treat cardiovascular disease, and go back into the lab to be able to look at those issues and try to come up with ways that we might either diagnose things earlier or to treat things in a different manner. As an interventional cardiologist, the main interest is in coronary artery disease, so disease and buildup in the arteries in the heart, and how that impacts patients and prevents them from having quality of life. So I treat acute coronary syndrome, so patients who have acute heart attacks, and people who have stable coronary artery disease, so a vast spectrum there. But the overall goal is to, treat the disease that's present, but also to try and define how we might either prevent the disease or prevent it from progressing, and come up with new therapies to help our patients improve their quality of life. For me, being in an academic medical center is critical. I think one of the things is that there's the interaction with all of my colleagues who are asking critical questions to what the cause of disease is, how we diagnose it, and how we might better treat it. I think that as a physician, we have the tools at hand that we can use to provide the care for our patients and to treat the disease states. And as a researcher in an academic medical center, we have the ability to ask the questions further to design how we're going to subsequently redefine how we treat diseases and come up with new therapies for our patients. Outside of work, I enjoy being outside and getting out to watch the kids in their soccer games or their swim meets, and also enjoy time spending with my brother-in-laws. They've adopted me as a city boy. They're country boys growing up on a farm, to go ice fishing or to go hunting with them. And so it gives me a relief just to get outside.